I'm Valsamo Anagnostou. I'm an associate professor at the Johns Hopkins School of Medicine, and we are focusing on development of liquid biopsy approaches and the implementation of liquid biopsy approaches in clinical cancer care. The field of liquid biopsies is a very exciting field with respect to development of new technologies that allow the very sensitive detection of practically tumor DNA remnants in peripheral blood. And it's also exciting because we're working towards the implementation of these exciting technologies into clinical cancer care. So we're using these minimally invasive approaches to help us make decisions in terms of how we treat our patients, in terms of how we identify patients with cancer that are at higher risk for disease recurrence, how we track tumor burden during therapy, how do we monitor a therapeutic response. And so, certainly liquid biopsies are now emerging as an exciting opportunity that can be implemented across the clinical cancer care continuum, and it's truly exciting to see the clinical validation and the clinical implementation of those approaches. Our area of focus is tracking response to immunotherapy for patients with advanced cancers, with cancers that are spread in the body. And this has been historically very challenging because if you think about how we monitor therapeutic responses in the context of immunotherapy, we typically do this by just imaging, right? So we re-image the tumor via CT scans or similar modalities, and then we make a decision whether the tumor is shrinking or whether the tumor is increasing in size. But what we know in the context of immunotherapy, we know that these measurements on imaging, they're just inaccurate. And so the imaging, which again is our golden standard in terms of assessing therapy response in the context of immunotherapy, doesn't capture the unique nature and timing of immunotherapy response. So what we truly need to do is implement minimally invasive approaches that can very accurately and in real time capture tumor burden and then help us make therapeutic decisions. So this is what we've been focusing on for several years now, and what we found is the following. So we've been employing very sensitive approaches. These are, I think, universally under the umbrella of next generation sequencing to actually track mutations in the circulation of patients with cancer and track them over time, and then identify specific profiles that may be associated with therapy response, tumor regression on imaging or tumor expansion and extension on imaging. And what we found is that in the context of immunotherapy, there are actually very distinct profiles with respect to ctDNA or circulating tumor DNA dynamics that are actually reflective of patients' clinical outcomes. And so this is the focus of what I'm going to be presenting at AACR this year, and certainly there is extension of these approaches now to the early stage disease setting that we will be discussing in our session as well. And of course, this is very relevant as immunotherapy is now moved from the metastatic paradigm to the early disease treatment armamentarium. So we truly need those very sensitive, nuanced molecular assays to dissect the clinical responses that we see with immunotherapy.